Locke, as we know, has been very outspoken, a critic of the coronavirus vaccine and masking efforts. Here's what he said about his Twitter ban on his Facebook page.
Can you believe it? They banned a pastor. They banned a pastor with a verified public blue checkmark platform on Twitter because I'm a danger. Oh no, it's because they just want to be where they censor us. We're over the target. We're dropping bombs, gospel bombs, political bombs, biblical bombs. They don't like what we're saying.
Pastor Locke says he plans to sue Twitter. Meanwhile, he's getting a lot of traction with that comment on Facebook. Mario Esposito writes, "They are afraid of the truth. So scary and sad for this country." Stuart Allen adds, "Twitter just took out the trash. Good for them." Alexis Brown says, "What happened to freedom of speech? They're taking away freedom right before our eyes." And Faylin Hall writes, "Freedom of speech does not apply to private companies like Twitter, Facebook, and Snapchat. Read the fine print," she goes on to say, in the terms of conditions. They reserve the right to end anyone's privileges at any time for any reason.
Hospital leaders say their last peak was in December when they treated 102 COVID patients. Now they've surpassed that and then some, hitting a record 103 patients as of Friday. Doctors say this is putting a major strain on hospital staff. A new surge in COVID patients at Murray Regional Medical Center, alarming for some Murray County residents, like Michelle High, who lost her father to COVID in December.
But I was there with him, laying by his side when he took his last breath.
High says her father's health deteriorated in just 3 days. It's a pain she doesn't want other families to experience.
Every time the phone rings outside of regular hours, you're wondering who passed away or who's in the hospital with COVID.
Sadly, more loved ones in Murray County are getting that phone call. Medical center leaders say they've treated a record high number of patients for the past week and a half, with no signs of letting up.
So this surge has been much more difficult for our system, much more taxing on our staff.
Hospital CEO Alan Watson says they're struggling to accommodate transfer requests and brought in more beds to treat more people.
I've been a physician here 19 years, and I see patients currently on ventilators in our hospital in places that I never thought I would see patients on ventilators.
They worry about what would happen if there was a mass emergency.
I'm not sure where we would put the patients. I'm not sure where we would have the resources from a staffing perspective to take care of them.
I reached out to Murray County Mayor Andy Ogles to find out what's being done to help protect people from getting sick and to open up hospital beds. My call went straight to voicemail.
The mailbox is full and cannot accept any messages at this time.
And my email was not returned. Doctors are urging people to take precautions like indoor masking and vaccinations to help lower the number of people getting admitted to the hospital. High says she's glad to take those steps.
I don't want to be responsible for giving it to someone else and having that person pass away or a child pass away.
She also encourages her neighbors to take precautions to help save others the pain of losing someone they love. Despite the surge, doctors still urge people to seek medical attention if they need it. They say last year they had a problem with people putting off medical care until it was an emergency. They say they do still have capacity to treat people in need.
Well, Tennessee, along with other states like South Carolina and Kentucky as well, are among the top places where COVID cases are spiking instead of slowing down. Well, area doctors here in Nashville say it's nothing short of disappointing.
That is the saddest number I have heard in a very, very long time.
That's Vanderbilt's Dr. William Schaffner, a world-renowned infectious disease expert, reacting to Tennessee being 7th in the nation for new infections. Last week, we were number 1.
It reflects so sadly because so many people in Tennessee, our neighbors and friends, have become ill with COVID, have had to go to the hospital, and so many have had to die.
Fox 17 reached out to Governor Lee's office asking if the state will impose stricter guidelines for COVID-19 safety if the numbers stay where they are. So far, no response. Dr. Schaffner says many of our cases, hospitalizations, and deaths could have been prevented through vaccines.
We still rank very low on the list of the 50 states in the proportion of our population vaccinated.
The state's vaccination summary shows 43% of Tennesseans are fully vaccinated. That's 44th in the nation. These rankings come as area doctors insist the vaccine is the foundation for safety.
I think we in infectious diseases and public health have to be persistent. We have to try to reach our neighbors and friends, listen to what their concerns are, provide them information.
Schaffner says it's never too late to turn things around. The question is, how many more people will get sick and how many more will die until we do?
Well, the report that we listed there in that story is released by federal health agencies as well as the White House. But another notable finding that I wanted to share with you all listed in that report shows Tennessee is in the top 10 as well for most new COVID hospital admissions per 100 beds.